Around 700 women die each year as a result of pregnancy or pregnancy-related complications in the U.S. This, according to the CDC. Well, 2/3 of these deaths are preventable. This number soars above other developed countries, and that number is climbing each year. In 2020, for every 100,000 live births, around 19 white women died, compared to 55 black women. Any mother that's torn from their family and community is, of course, a tragedy. But what's behind this stark difference that you see here, and what's being done to address it?
I remember being very, very deep in the throes of labor, sitting on the side of my hospital bed and saying, "No one touches me until I've given you my consent." And I remember the energy in the room shifted as though I was being difficult.
It breaks my heart because it still shows me that the system is not made for us.
The latest numbers from the CDC show that black women died from pregnancy-related causes at rates nearly 3 times higher than non-Hispanic white women. Dr. Michelle DeBink with University of Utah Health and Black Physicians of Utah specializes in maternal fetal medicine.
So many of these deaths are preventable. Is differences in the way that we treat each other and the differences in the way that opportunities for health are structured in our society.
A doula is someone who parents bring on for support and guidance throughout pregnancy, during labor and birth, and beyond. When one local activist and doula saw the numbers, she decided she had to do something about it.
I just can't sit back and see my people die.
Ashley Finley, calling herself a birth keeper.
And what that means is that I feel very ancestrally knowledgeable and wise about the process of bringing a new life Earthside.
She specializes in culturally competent care for marginalized parents. Kendra Foster was 30 weeks pregnant when she finally found a doula who matched her criteria, and that was Ashley.
I wanted someone who understood me, not just as someone who was going to be a new mom, but someone who was going to be a black mom.
Ashley's care is custom to the needs of her clients, with frequent visits during pregnancy.
She was bringing flowers and snacks and coming over to just hold my belly and
establishing a birth plan, a vision of how parents hope to bring their baby into the world, whether at home, in a birthing center, or in the hospital.
We put all those details into plan, always being flexible because we know that babies kind of laugh at our plans sometimes.
But for each birth in a hospital, some things are constant in Ashley's practice of protection.
I feel strongly about making sure that, especially in a hospital room, that people know that this person has a doula.
This is so hospital staff know this patient has an advocate.
Because it meant not having to explain that I was scared. It meant not having to convince them that the risk of death was real. And it just meant a sense of safety.
She also empowers her clients to ask questions and give medical staff pause.
It reminds specifically black women that we have autonomy, that our bodies are ours, that our births are ours, our babies are ours.
So what can be done?
The support of the expansion of midwifery and doula care within the United States would be a huge step in the right direction.
We know how to keep us safe. We know how to keep our babies safe and bring them here.